Zoom. And once you're on your back, just sense your spine touching and which parts of your spine are touching, which parts of your spine are not touching.
Can you hear that noise?
No,
Okay.
no noise over here. Zoom filters it out.
Sounds like a buzzsaw.
If you want me to mute you, I can, but I don't hear anything. Aloha,
Okay.
Teresa. And then just sense how evenly do you feel between your right shoulder and shoulder blade and left shoulder and left shoulder blade. And your head, does it feel like it's lying in the middle? The middle of the back of the head? And how big is the distance in your objective, subjective perception of your right ear to the right shoulder and the left ear to the left shoulder? And just sense the width of your mouth and the middle of your mouth. And the width of your jaw and the TMJ. The joints. And then smile once towards the right ear and come back center, and towards the left ear and come back center, and just sense how evenly or unevenly are both sides working. And then let that go and sense the tongue lying in your mouth. And do you feel like the tongue is actually very evenly lying in your mouth? Now move your tongue from the root, not from the tip, but from the root, and press it towards the inside of the teeth on the right. And then coming back and then press it to the teeth on the inside to the left. So the root of the tongue, so the tip is relaxed. So the sides will move to the teeth. And maybe one side is closer than the other. What are your eyes doing when you do that movement? And then let your tongue rest again and just sense the width of your tongue. And bring your feet standing. Bring both feet standing, so bend your knees. And sense the two sides of your pelvis lying and how well the right side of your pelvis and sacrum is lying and how well is the left side lying. No, 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 the feet are standing. Feet are standing, yeah. And then press once the right side of your pelvis into the floor, and that would be, if you're lying on a dial, that would be 9 o'clock, and once the left side, that would be 3 o'clock. The knees point towards the ceiling, and so it's just a small movement. And sense if you have maybe a little bit more ease on one side. And then put your hands on your ribs and feel that little movement in your ribs, so underneath your hands. That there is that turning that obviously has to happen in the thoracic spine. Watch your breathing. When you press, breathe in, or when you press, breathe out. Maybe one side does a movement a little bit differently than the other side. So you feel like, you're not on the same spot on your sacrum. Now, instead of, so you're probably pushing from one foot, pushing from the other foot, right? So now lift from the glute. So now, you're still doing the same thing, but you're engaging with the glute a little bit more. So you're pressing down because the other side of your pelvis, the glute is um, engaging. So in essence, it's the same movement, but you're just focusing a little bit more on engaging with the glute. Okay, and then lengthen your legs out and sense how you're resting now on your spine. How you're breathing. And then smile again with the right side of your face and with the left side of your face, and feel if it may have changed a little bit, maybe not. And then Just engage with your legs long, your right glute, and see how your pelvis is tipping a little bit, and then the left glute. So if your ribs are allowing it, you feel that same 3 o'clock and 9 o'clock, but just now only from the glute. Maybe you sense it arriving in your shoulder and clavicles and shoulder blade. And then let that go, rest for a moment. Put both feet standing again. And bring your right leg a little bit towards the midline inward. And sense where would the midline be? How far would you go with the knee? And sense how you're shifting weight onto your left side of the pelvis. And then you come back, and then the same thing to the other side. So where are you with your knee on the midline when the knee goes inward? It's a small movement. But even so, you're doing a fairly small movement, since how your pelvis is probably going from 3 to 9. Now take your feet a little bit further apart. And do the same thing again, and sense how, because your feet are further apart, the movement changes in the pelvis a little bit. So bring your hands actually on your pelvic bones, there where the pubic bone meets, the pubic bone is part of the pelvic bone, but you can put a little bit more outside, and just sense how that if the knee goes in now towards the midline, that side will lift a little bit and pull down. And then start to make the movement bigger, so you are actually really moving that femur further down, crossing the midline. And when you come back, sense to which numbers on the dial you are pulling your pelvis back. So if you're lying on a dial, our famous Feldenkrais clock, when you pull back that femur from crossing the midline, which dials are you actually pressing down on in order to come back to center? When I bring my left knee in, right, I'm shifting on to the right side, so I can go, let's say, left knee in, then I'm on 9 o'clock, or maybe I'm actually on 8 o'clock and then slowly pulling back, rolling from, 9, 10, 11, 12. So maybe that's happening for you. Now you also feel it pulling on your shoulder girdle. And then slowly lengthen your legs out and sense how you're resting now on both sides of your pelvis. Now bring your arms into the air and bring the hands on the midline together. So the midline is between your hands. And now just very gently move your hands a little bit left of midline and back center, a little bit right of midline. So you're rolling, it's not big, it's really small. You're rolling a little bit more onto one shoulder blade. But sense that little movement, you can feel it in your ribs where you had your hands earlier. Now keep your hands in the middle and engage again with one glute and then engage again with the other glute. So your pelvis rolls a little bit from right to left and left to right by engaging with the glute. Your hands are staying in the middle, but you feel it maybe, and the side that you're engaging, maybe you feel that shoulder blade moves a little bit down or backwards, maybe. And then bring your hands back. Put your feet standing. And feet are standing normal distance, not too close. Feet are standing normal distance. Yeah, put feet standing. Yeah. And then engage again with one glute that you're lifting that side, rolling on the other. So it is a 3 and 9, but by engaging and you're pressing the foot, of course, but it is the impetus is the glute that is engaging. So that side, the hip is rising. And that makes the movement a little bit bigger, a little bit more powerful, right? So if I'm engaging with the glute and pressing with the foot. Now bring your arms up again into the air. Glue the palms together. They cannot slide. And now you're bringing both hands a little bit of the right of the midline and back center and left of the midline and center. And just sense how that midline relates to your sternum. Now Next time you bring your hands to the left of the midline, your right glute engages and you're going, you're rolling a little bit onto your left side. Just do that a few times, just with the going to the left. So engaging, bringing your hands to the left of midline and engaging with the right glute. Then you can feel there is no movement in your ribs. It all moves pretty much like a block. Okay, rest your arms, keep your feet standing. Sense your breathing. Bring your arms up again. Just cross your midline or on the midline. And then engage with the left glute and roll with the arms a little bit onto the right shoulder so the hands go a little bit to the right of the midline. And you return, of course, always to the midline. So your head probably rolls a little bit too. Keep breathing. Okay, and let that go. Bring the hands back, lengthen your legs out and sense how are you lying on the floor now. Maybe you feel your glutes are bigger now. Now bring your feet standing again and place them well. Bring your hands into the air again, glue them together on the midline. And now you engage with the right glute, but you bring your hands right of the midline and come back. And do that a few times. The right glute, so the right side of the pelvis is lifting, the hands are going right of the midline, and have your head keep the midline. So that would be a movement with the exception of not having the arms forwards like that, but a movement we do walking when we keep the head in the middle and we're having the shoulder girdle turn against the pelvis. Okay, let the hands come down, keep your feet standing. Put your arms up again, glue your hands together, and then bring your hands a little bit to the left and lift the left side of the pelvis up and by engaging the glute. So hands are just a little bit of the midline to the left, engaging the glute. So your pelvis rolls to the right. Head stays in the middle. Keep breathing. And then bring your arms back, lengthen your legs out, and sense how you're resting now on your midline. Is your midline maybe a little bit clearer? Now bring your arms up again to the midline and have your, you keep your arms there without doing anything, and let the tongue, the back of the tongue, the root of the tongue go again right and left. So you're moving probably your nose a little bit out of midline, and then you're lining again with your hands. So when you move the root of the tongue to the side, a little bit closer to the teeth, to the left or the right, your nose, probably your head starts moving on the atlas. And that puts the tip of your nose a little bit out of midline. And then bring your hands back and your arms down. Now bring the soles of the feet together and bring your arms up again to the ceiling. And now do the same thing again, that you're moving the tongue to the right and the left. Now let your eyes go opposite. So when the root of your tongue goes to the right side of your teeth, your eyes go to the left of the thumbs. And the tongue goes to the left of the teeth, the eyes go to the right of the tongue, of the thumbs. And then rest, put your feet standing, take your hands down. Yeah, sense how you're breathing. Bring your arms up again, glue your hands together, and move the root of the tongue again, right and left, and have your eyes go with the root of the tongue, returning always to that center line, looking at the thumbs. Sense what that does to the side of your neck. So your head gets pulled a little bit so that the nose moves out of that midline. Bring your hands back again. Keep your feet standing. Bring your hands together again in the air. And this time, let your eyes go left and again. So we did that before. And the root of the tongue to the right. And then eyes go right and root of the tongue to the left. Do it softer. And then make a point of returning clearly to the midline with your tongue and your eyes. Bring the hands down again, lengthen your legs out and rest. Sense how your eyes, your eyeballs are lying in the socket. Maybe you feel your mouth is in a relaxed smile without you having to do it. How is your tongue now lying inside of the mouth? Now bring the soles of the feet together. And start to engage with your right glute, and see when you engage with the right glute, the right knee will lift, and just do it on the right a few times. But it also might move a little bit towards the left armpit, or it might lengthen your neck a little, or move your neck. And then rest for a moment, lengthen your legs out. Bring the soles of the feet together again on the midline. And engage with the left glute and sense maybe that's easier, maybe that's harder, and sense how that moves your pelvis, lifts the left knee a little bit. And maybe you feel it pushing diagonally towards your right armpit, towards the neck. So make sure your left knee is allowed to lift a little bit when you engage with the glute. Okay, and lengthen your legs out and sense how you're resting. Now with the legs long again, engage with the right, engage with the left, and just sense if you can toss your pelvis a little bit right and left with your glutes so your pelvis starts rolling. You can do a little bit faster. Plop, 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 plop. You engaging with one side of the glute and then with the other, and then your pelvis starts rolling from 3 to 9 and 9 to 3. Yeah, yeah. So it's a little bit, yeah. So Susan, if you want, you can do a little bit faster. So you start plop, 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 rolling. Yes, there you go. There you go. Yeah. Okay, but before the glutes get too tired, rest. Roll onto your side and come sitting. Lean on your hands if you can. Bring the soles of the feet together. And then engage with one glute and lift that side of the pelvis. And actually, you feel the other side also has to engage when you lift. You can push off the outside of the foot as well. But then the hip, when, where I'm lifting, when I'm engaging, the hip joint will lift up quite a bit. Open up, not lift up. Open up quite a bit. Okay, let that go. Lengthen your legs out. Now, if you can sit without your hands, you sit without your hands. If you cannot, you lean on your hands somehow. You can sit easily enough without your hands. You're doing that. Now take your hands together. If you can sit with you, need your hands, you're not, you just leave them behind if you can. And now engage with one glute and then engage with the other glutes. You're lifting one side up as if you're walking. Now, since you can feel that in your ribs again, one side will, where's the head going when you engage with the glute? Yeah. Okay, rest for a moment. Bring your right leg back and the left leg front and lean on your left hand. Take your right hand onto your right glute and then engage. Yeah, right. Yeah. So right leg is back and left. Yeah, good. Yeah, yeah. Yes, you're leaning onto the left hand. Yeah. I think everybody is sitting and now the right hand is on the right glute and then engage with the right glute and help the glute to move forward. Move forward. Yeah. So you're moving around your left arm onto the left hip, right? Okay, good. Let that go. Rest however you need to rest. Both hands are around your left knee if you're still sitting with your left leg in front. So your knees in between if you can, if that is, So you're leaning more forward, right? In this position, the right hip is lifted more. And now do very small little pushes from the right side of the pelvis, from the right glute towards the head. Push, you're engaging with that glute and pushing yourself a little bit forwards as if you're rocking. So instead of doing it from hands, you're doing it from the glute. You're rocking your pelvis, the right side of the pelvis a little bit forward. Left leg is bent forward. Julie, can you bend that left knee more? I can't. Yeah, so the right leg is back and the left leg is front. Not possible? Okay. Okay, so you're just doing it. You're just finding a solution there. Okay, good. Let that go. Take both legs front and rest for a moment. And sense the difference between the right side of the glute and the left side of the glute. No, just yeah, for now. Yeah. Maybe you feel your right leg is different. Now take both legs to the left. So right knee is bent forward, left leg is backwards. If you cannot bring him so far back, you can always do what we did the other day, knees more together. If you can, put it behind, you do. You're leaning onto your right hand. You don't have to lean a lot, just a little bit of a lean. And then left hand is on your glute and you're lifting. You're engaging with the glute and lifting that side up so the thigh, the left thigh bone comes forward. And you're getting a stretch in your hip joint here. And of course, your ribs have to move, right? The ribs on the right have to open, and the left, they have to pull more together. Okay, good. Rest any way you want. Put your right leg in front again, left leg to the back. Both knees are bent, and you put your hands around your right knee. Yeah, there you go. And then you engage again with the pelvis, pushing with the left side of the glute and pushing towards the head. So you're getting a little bit longer. And then let that go. Take your legs forward or however. Sit for a moment, sense if you feel differently on your sit bones. And then roll slowly back into your back again and lengthen your legs out, and that's how you're resting now. Put your feet standing. And bring your arms up to that midline again. And bring your right knee again towards the midline, just a small little movement. And then engage with the right glute and bring that knee back. And then bring the left knee, just lean it in a little bit to the midline, and then you engage with the left glute and the left foot and bring it back. So you're alternating the sides. And since when you bring it back, engaging with the glute and the pelvic floor, you are pushing towards the midline, the head, your arms staying on the midline, on the they don't move to the right or left. You can start to make it bigger if that's easy, meaning the knee can go down a little bit more. You have a question, Deborah? Yeah.
When the knee goes down, then does the right side get longer? I mean, the same side get longer and the neck gets shorter on that side?
So you have the left now, when the left knee goes down, yeah, it pushes actually along the midline, and yes, in a way, it feels like the left side gets a little bit longer. Yeah.
Okay.
So it pushes on the left side of the spine. I mean, in a way, the whole spine gets longer, but you could say on that side gets a little bit longer. Um, Susan, you could bring your feet a little bit further apart, just a little bit further. Yeah, yeah. Okay, and let your legs lengthen out and sense how you're lying on your back now. Take both arms up again onto the midline. And move your hands again a little bit left of the midline, so you're more on your left shoulder blade and center, and a little bit more onto the right side of the midline. And so this time your thumbs are moving, but keep your eyes where the thumbs were on the midline. So your head then will stay on the midline as well. So if you do the movement a little bit bigger, then the one shoulder lifts while you're moving, rolling onto the other shoulder blade. Now keep your nose in the middle, but have your eyes follow your thumbs. And then you bring your hands down and bring your hands onto your pubic bones. And again, like we did earlier in the lesson, engage with one glute and you're rolling onto the other, and the pubic bone on that side is lifting, of course. But sense also in this position what happens with your shoulder blades. So when you lift the left side of the pelvis, what is your left shoulder blade and your left clavicle doing? They may be doing the opposite. So when the pubic bone lifts, the clavicle and shoulder blade fall a little bit backwards. And if the nose stays in the middle, then there's also where the shoulder goes backwards, the neck gets a little bit longer. Okay, let that go. Put the feet standing and put the soles of the feet together. Now, have your hands on the ground with the palms down, and then roll your pelvis from 3 to 9 and engage. You're pressing from the foot, but you're engaging also with the glutes. So now this movement is fairly big. And since if you are lifting let's say the left side of the pelvis, rolling towards 9 o'clock, the left shoulder falls backwards and the left elbow is pushing, right? And when you're rolling to the left, lifting the right glute, then your right shoulder blade goes back and the right elbow could be pushing. The head stays right now in the middle. Okay, let that go. Put the feet standing for a moment, rest. Bring your arms together again on the midline and lengthen your right arm and your chin lifts. So now your hand slides on the midline, your arm lengthens. Now, we usually don't engage with the shoulder. Now, if you think of shoulder and hips being similar, we don't have glutes necessarily on the shoulders, right? So, but still see if you can engage with the muscles around your shoulder blade a little bit more. So it puts it a little bit down in order to reach. And then you come back. And then engage with the muscles around your left shoulder blade and lift it up. So your ribs have to do the lifting and your thoracic spine, the lengthening forward. So see if you can somehow imagine you would have glutes in your shoulders and you're engaging a little bit more before you lift up. Depends how that is and what your neck is doing. Your chin hopefully follows a little bit the arm, so the head goes backwards. Deborah, the feet for that are standing. Yeah.
Hmm?
The feet are standing for that. Yeah. You're engaging, you're almost pulling the shoulder blade down a little bit, engaging as if you had glutes on your, on, behind your shoulder. Yeah.
Same hand and shoulder or opposite?
No, when you're lifting, the arm you're lifting, that's where you're engaged. Like when you're lifting the right side of the pelvis, then you're engaging with the right glute, right? So now, again, we don't have the same setup there, but you would engage with the right muscles around your right shoulder blade in order to lift. Normally we just roll, but here we are, just engaging prior with the muscles around the shoulder blade and underneath the armpit. Okay, good. Let that go. Lengthen your legs out and sense how you're lying now on your shoulders and shoulder blades. Now move again the tongue, the root of the tongue a little bit to the right and to the left and sense how that is going and how evenly you can do that to the right of the midline and left of the midline. How does it move your atlas? Is your atlas moving a little bit to the right of midline or to the left of midline? And then rest. Bring the soles of your feet together again. Bring your hands again to the midline. And engage with the left glute, roll the pelvis to the right. And come back center and then engage with the left glute, engage with the right glute, roll the pelvis to the left. Now let the arms go a little bit opposite. So when the pelvis rolls to the right, arms go left of the midline and then everything comes back. Arms going right of the midline when the pelvis rolls to the left. And now how would you use the root of your tongue with that? Does it go with the pelvis or does it go with the arms? If your head is supposed to stay in the middle, okay, and rest. Right, if I would go with the pelvis, it would help my head to stay more in the middle. Otherwise, my head would roll with my arms. And sense what has changed, the way you're touching now. Do you feel more centered, more balanced? Now just smile again to the right and smile again to the left. The sense of that's easier. And then slowly roll to your side and come sitting. I'm already over the time today. Too much fun here. And then slowly take your time, come standing. And sense how are you standing now on feet. And how's how your arms hanging? How's your midline? Smile. And then start walking a little bit and sense at what point could you engage your glute to actually walk. What time of your walk could you use your glute to push you? And you feel if you use your glute when with the back foot, you're also pushing better of that foot.
Oh, yeah.
Right? All the movements we've done with pushing of the back foot there, if you combine it with your glute, you actually get more of a push forward. You get a more powerful walk. Okay, but I don't want to keep you forever. So slowly come back. You can experiment with that a little bit more. Julie, how are you doing?